Welcome to the CAREC Distance Education Program and our first Epidemiology training module on the subject of outbreak investigation and control. Effective epidemic investigation and control can save lives and money and requires a sense of urgency until the investigation is complete. Competency in this vital aspect of public health practice can be acquired by studying this video series and participating in other training, exercises, and field investigations.
When? What happened? Is sick? What happened?
I sure is a potato salad.
I don't know the amount of thing I eat in that fat. I know.
I tell you not to eat that thing.
Oh gosh.
Look, I better call Marilyn, yes?
Oh gosh, I studying them foreigners who playing in the band. If them eat that and get sick, what we gonna do? Them people wouldn't come back. Tomorrow is the Mashka. Who go tote my costume across the stage? Carnival Monday and Tuesday. The band who
Look,
organize
this thing's
the
serious
band.
because a lot of people call Marilyn, not only me. A lot of people sick after the fete. So we better go to the hospital.
Oh gosh, no.
Come on, yes, you have to go to the hospital.
Oh, hey. Oh.
So tell me, what did you have to eat?
It started with the fried rice, fried chicken and the potato salad. Then I had a hamburger, a hot dog, roti with potato and chana, a oil down, and last I had some corn soup.
This looked like a case of food poisoning.
Definitely, because this is the 15th patient we have seen from that same fete. We need to call the public health immediately. And that fete was huge. So this could be like widespread. Actually, I have to go to a meeting, but this is much more important. So let me call the medical officer of health right away. So let me do that.
Hello, I'm Dr. Eldona Boisseau, one of the epidemiologists here at the Caribbean Epidemiology Center, commonly known as CAREC. In this video that you're about to see, we will describe the initial steps in an outbreak investigation, using diarrheal disease as an example. After viewing this video, you and your team should be able to do the following. 1. Describe the 4 major goals of emergency responses to an outbreak. 2. Outline the 10 steps involved in an outbreak investigation. 3. Describe in further detail the first 3 of these steps. And 4. Describe the roles and responsibilities of each member of an outbreak investigation team. Now, let us begin by discussing why an outbreak is not business as usual and often extends well beyond regular working hours. An outbreak is a public health emergency. And as with all emergencies, it must be top priority. The reason why the immediate investigation of an outbreak is so important is because there are 4 goals that must be achieved in a timely fashion if the outbreak is to be properly controlled. The 4 goals are: 1. Case management. This activity aims to minimize the effects of the disease causing the outbreak. In other words, minimize the occurrence of severe morbidity and mortality. 2. Containment of infection, which aims to break the chain of transmission and prevent the further spread of infection from those who are affected to those who are not. 3. Active search for new cases. This is to monitor the development of the outbreak and assess the effectiveness of the control measures being implemented. 4. Protection of susceptibles. This is the identification of risk factors and populations in danger of contracting the disease, and then using these methods to protect these groups from becoming infected. Referring to the scenario that you saw earlier on, this could indeed be part of an outbreak. If this is an outbreak, there could be serious implications, not just for those affected, but also for the wider community. Outbreaks can result in serious illness for many people, some requiring hospitalization, some even dying. Countries' economies can be affected by outbreaks, particularly ours here in the Caribbean, as most of our economies depend heavily on the tourism industry. With so many media available today, countries cannot hope to keep news of outbreaks secret. They must be prepared to conduct proper investigations so that accurate information can be provided as soon as possible. We must remember too, the bigger the outbreak, the more expensive it is for the Ministry of Health to handle. Investigating an outbreak is not a one-man job. It is a team effort. This team should include a team leader who should have strong epidemiologic skills. Often this person is a medical officer of health. A public health nurse to collect and collate data on cases and often also on controls, as well as to collect past data on cases so that disease events over time can be observed. A public health inspector to conduct site investigations. In an outbreak of foodborne illness, these sites may be food establishments or hotels. A designated spokesperson to communicate with the media so that clear, consistent messages are delivered to the public. It is important that the public receives accurate information from the Ministry of Health, which is not necessarily the type of information that sells newspapers, etc. Somebody to provide data entry support so that data can be analyzed and information generated as the investigation proceeds. Someone to provide statistical support, to assist with the analysis of data and the production of relevant tables, charts, etc. for reports. Laboratory support, to confirm the etiologic or causative agent responsible for the outbreak. Of course, depending on the availability of resources and the size of the outbreak, one person may perform more than one of these roles. While each of you have specific expertise, within the context of investigating an outbreak, you may be assigned other responsibilities by your team leader.
Public health. Yes, hello, good morning. Hi, is this public health? Hi, can I speak to the medical officer of health, please? Thank you.
Yes, hello?
Oh, hello, good morning, doctor. Nurse City of CAREC Hospital speaking?
Nurse?
Yes, I'm calling because I've seen 15 patients, only this morning, with gastro-like symptoms.
15 cases?
Yes, and 2 are very severe. And actually, they all attended the same vet.
That's interesting. We will be there.
Okay, thank you very much, doctor. Okay, bye.
I need to check the health centers. Hello? Is this the Northern Regional Health Center? Could I speak to the attending nurse, please? This is the medical officer of health. I'm calling to find out, have you been seeing patients with gastro-like symptoms? Aha. And when did they begin to come in? How many of them have you seen? No, just a rough estimate. Could you find out for me whether any of them attended the Caribbean Fun Fete? Okay, we will be getting back to you shortly. Hello, Northwestern Health Center?
Linkages between health institutions are extremely important in the investigation of an outbreak. You must know the reporting structure in your country. If, for example, you're the medical officer of health and you get a report from one hospital of 15 cases of gastro-like illness in the last 12 hours, you should surmise that this is an unusual situation. But is this an outbreak or not? You should know what steps to take in the management and investigation of a situation like this. There are 10 steps that should be performed in a successful outbreak investigation. These steps are: 1. Confirm the existence of an outbreak by comparing current disease data with earlier data. 2. Verify the diagnosis by reviewing the clinical findings and/or the lab results. 3. Make a quick assessment of the patients and formulate a case definition. 4. Relate the cases in relation to person, place, and time. 5. Formulate a precise hypothesis. 6. Plan and conduct a detailed epidemiologic investigation. 7. Analyze the data. 8. Formulate a conclusion. 9. Put control measures in place. 10. Write a clear and concise report. We will now focus on the first 3 steps in an outbreak investigation, relating them to the situation that was occurring at the Kariba General Hospital. The medical officer of health and the public health nurse must now prepare to go to the hospital to confirm whether or not an outbreak is occurring. This is the first step in an outbreak investigation.
We need to ensure that we take with us rectal swabs, containers for fresh stool samples, and we will leave with them the CAREC for the bacteriology, the viral transport medium, and the transport medium for the parasitology. We'll also be carrying some case investigation forms.
Remember, an outbreak or epidemic is defined as the occurrence of disease clearly in excess of what is normally expected. In fact, the word outbreak and epidemic mean exactly the same thing. It's just that the word epidemic often conveys a greater sense of panic than the word outbreak. So, on arrival at the hospital, the first thing would be to examine the outpatient's records to obtain information on the occurrence of diarrheal illness in previous months. They may also wish to look at the occurrence of diarrheal illness in the same month in the previous year. Interviews with hospital staff may quickly confirm that this level of attendance for gastro is extremely unusual. Historical data will be compared. The number of cases of diarrheal illness seen weekly will be graphed. This type of graph is used to identify endemic levels, that is, what usually occurs, and epidemic levels, that is, clearly in excess of what is normally seen. In this situation, it is clear from the graphs that there is an increase in illness above what is normally expected. Cases in excess of the endemic level confirms that an outbreak exists. And this does not necessarily have to involve large numbers. In our region, the Caribbean, one case of a disease such as yellow fever, rabies, measles, or polio would be an outbreak, since we would normally expect to see 0 cases of these diseases. Now that the Kariba team has confirmed the existence of an outbreak, they need to verify the clinical diagnosis with a laboratory investigation. This is step 2 of an outbreak investigation. The medical officer of health should discuss the signs and symptoms of the patient seen with the attending physician to determine what lab tests are required. For example, if the physician said the patients had bloody stool or stools with mucus, tests for Shigella, E. coli 0157, or Entamoeba histolytica should be considered. The medical officer of health should find out if specimens had been obtained from the patients, but understand that there's no need to obtain a specimen from every single patient, only enough to enable the causative agent to be identified. The lab must also be notified to expect more samples than usual. The lab should use standard assays and communicate any specific testing requirements to the hospital staff responsible for collecting specimens. For example, they should know that stool samples are preferred over rectal swabs, and they should be fresh samples. Step 3 of an outbreak investigation is to formulate a case definition so that a quick assessment of the patients can be made. Remember, a case definition is a standard set of criteria that can be used for deciding whether or not a patient should be included as a case of the disease under investigation. The case definition must include information relating to person, place, and time. It must include signs and symptoms. It must be clear as to whether suspected, probable, or confirmed cases will be utilized, and also be clear as to whether cases to be confirmed clinically, by laboratory, or by epidemiologic linkage. If the team wants to be sure to capture all cases, the case definition should be fairly loose, using minimum criteria for inclusion. Many investigations start with a loose case definition, and this definition becomes tighter as the investigation proceeds.
Now, the case definition we will be using in this outbreak will be: 1, they should have attended the Caribbean Fun Fete. 2, they should have diarrhea and one of these following symptoms, either abdominal cramps, fever, or vomiting. And 3, that the illness should have been contracted between the day of the fete and the 14th. That's the case definition we're going to be using in this instance.
Steps 1 to 3 of the outbreak investigation have now been completed. But remember that in order to complete the entire investigation, the remaining 7 steps must be done. So, let us recap some of the important things we discussed today. An outbreak is a public health emergency and must be investigated quickly and efficiently. To do this, 4 goals must be achieved: case management, containment of infection, active search for new cases, protection of susceptibles. There are 10 steps in an outbreak investigation, and the first 3 of these are: confirm that an outbreak exists, verify the diagnosis, make a quick assessment of the patients, and formulate a case definition. Finally, an outbreak investigation is not a one-man job. It is a team effort, with every member of the team having a specific function. Hello, this is the second video in a 3-part series on the steps involved in conducting and managing an outbreak investigation. In the first video, the medical staff at the Caribbean General Hospital suspected that there was an outbreak of diarrheal illness following the Caribbean Fun Fete. The medical officer of health was contacted, and he and his team were able to confirm that this was indeed an outbreak. They also verified the diagnosis, made a quick assessment of the patients, and formulated a case definition to be used in the outbreak investigation. So, the first 3 steps of the outbreak investigation had been completed. That is, confirm the existence of an outbreak, verify the diagnosis, make a quick assessment of the cases, and formulate a case definition. After viewing this video, you and your team should be able to relate cases in an outbreak, formulate a hypothesis, and plan and conduct a detailed epidemiologic investigation. You will need to relate the cases in terms of person. Are the cases male or female, young or old? Place. Where did the exposure occur? At a common event or occasion? What areas did the cases come from? And time. What was the time or date of onset of illness? Let's go back to the scenario in Kariba. How will they relate the cases in their outbreak?
Nurse, the people that attended the Kariba Fun Fete and had to be admitted to the General Hospital within the last 2 days, we need to do a line listing of the cases.
Yes, I already have
Excellent.
it here.
Hold on. These surnames could probably be the same. We may have a duplication here. I'm seeing the same age, both female, same town. We need to check this to make sure that we don't have a duplication.
Okay, doctor, I already checked it. There's no duplication. Everything is right.
Okay, now what we need to do at first is we need to do a tally of the cases, male,
I have
female.
also done it.
We did the tally sheet. Good. Now we need to look for patterns. Have you found any so far?
Yes, all the cases experienced diarrhea. Some also experienced abdominal cramps. A few had a low-grade fever or vomiting.
Have you noticed any patterns related to age? And the cases seem to have started between 8 and 24 hours after the fete.
Yes, also there was no association between the place of residence and the illness.
The medical officer of health and the surveillance nurse have described the cases in terms of person, place, and time. An epicurve will further help them to orient the cases in terms of time. As described in the first video, an epidemic curve, or epicurve as it's commonly called, describes the occurrence of cases over time. The cases are on the y-axis and time is plotted on the x-axis. There are two types of epicurves. Firstly, there is the epicurve for a point or common source epidemic. This curve usually has a buildup of cases to the peak of the epidemic and then tails off. If there is a long exposure to the source, it is called a continuous common source epidemic, and the shape will be a plateau rather than a peak. Sometimes there are outlier cases which may or may not be related to the epidemic. A case occurring well before the other cases in an outbreak could be a child who was fed early, or a cook who had had an early taste of a contaminated meal. A case occurring well after an outbreak could be someone who unknowingly ate leftovers from a contaminated meal, and often this person has more severe illness than the other patients in the outbreak. The second type of epicurve is propagated. In this situation, there is person-to-person spread. This epicurve usually consists of a series of peaks continuing over time, one incubation period apart.
Doctor, I also sketched an epicurve.
Great, let's have a look. This is without doubt a point source epidemic. Look, the fete is here. We have the first cases 8 hours after. We peak 14 hours after, and the last case is 24 hours after.
The medical officer of health and the surveillance nurse have fully examined the data in the line listing and are now ready to formulate a hypothesis. A hypothesis is a supposition based on known information to be used for further investigation. It should be as precise as possible and used to guide the investigation. It should incorporate all clinical, laboratory, and epidemiological facts as well as known facts about the disease and environmental information if available. The hypothesis could include the source of infection, mode of transmission, and risk factors for the disease.
The clinical presentation of this outbreak is diarrhea with or without one of the following: abdominal cramps, fever, or vomiting. And the incubation period is between 8 and 24 hours. Hold on. Hello? Yes. Okay, thank you. I just got the test results from Mr. Halls, the guy that ate everything from the vet. It's salmonella. Let me just check the incubation period for salmonella. Yeah, salmonella. Incubation between 8 and 48 hours. This matches the incubation period on the epi curve. Salmonella. Salmonella is usually associated with eggs or poultry. Eggs, mayonnaise. I suspect it may be the potato salad that may have been contaminated. Nurse, don't forget to follow up on the 5 other samples that were sent to the lab from the Caribbean General Hospital.
Yes, doctor.
The medical officer of health and the surveillance nurse have formulated a hypothesis. They're now ready to conduct an epidemiologic investigation. This is necessary in order to either be able to prove the hypothesis is correct or prove that it is incorrect.
Should I contact the public health inspectors for an environmental investigation?
An environmental investigation would be ideal, but the field site of the FET is now empty and the vendors would no longer have samples of the food they served that night. So I believe we need to stick to an epidemiological investigation of the people who attended the FET.
How can we investigate everybody? That FET was a very big event.
Well, we're not going to be able to find everybody. That's why I feel we need to do a case control study.
There are 2 types of studies that can be done in an outbreak investigation: a cohort study or a case control study. Let us consider each of these. A cohort study is an observational study in which participants are selected on the basis of whether they have an exposure or not. It's the type of study that's usually conducted for small, well-defined outbreaks when it's relatively easy to reach all the persons involved. A case control study is an observational study in which participants are selected on the basis of whether they have the disease under study, defined as cases, or do not have this disease, defined as controls. This is the type of study that is usually conducted for larger outbreaks, where it is either impossible or impractical to interview all the cases.
We need to contact the sick people from the line listing, and we need to ask them if they know of anyone else who may have attended the FET and got ill, and secondly, if they could give us the names of 2 persons who may have attended the FET and did not fall ill. We'd also need to contact the organizers of the FET and get from them a listing of all the foods served at the FET.
That really would be a long list, but we really need this information.
Well, in designing the form, we could use the case investigation forms from the CAREC surveillance manual, and we would have just amend it to our purpose.
Yeah.
Okay. Name, age, sex we need. Now, as we're not using the computer, we could leave out the case ID. We're definitely going to need the phone number because I suspect we're going to do this through phone interviews. Occupation and employment, they're not necessary in this instant.
I have the amended form here. Would you like to have a look at it?
Yes.
It really is a lot shorter.
This is good because we'd always want these forms to be as simple and as relevant as possible.
A standardized case investigation form should always be used in all outbreak investigations. A case investigation form should always contain basic demographic information about the case, such as name, age, gender, and contact information, such as address and phone number. Contact information is essential in case you need to ask some of the cases further questions later in the investigation. Information such as occupation and place of employment would be important if there was some suspicion that the exposure was related to one of these factors. A case ID number is useful if a computer is being used for analysis. The case ID number on the form and on the record in the computer should be the same, so that if an error was discovered on the record during analysis, the form could easily be referred to for verification. Date of onset of illness is essential, and time of onset of illness can be collected if it is likely to be reliable. Signs and symptoms are also essential. They should be relevant to the disease under investigation. If patient specimens have been obtained, information on these, such as date of collection and results, should also be included on the form. Food history is essential. If the exposure occurred at a specific event or function, a list of the food served should be used. If the time of exposure is not known, then a food history for a specified time should be used. Additional information, such as travel history, housing conditions, and so on, become important if there's no suspicion about the source of infection. Finally, there should always be a place for additional comments or remarks, and also for the interviewer completing the report to sign and date.
Doctor, how will the questionnaires be implemented?
Well, nowadays we have several options. Face-to-face interviews, phone interviews, and we now have email, and well, there's regular mail. Even though I don't think that the regular mail would be a good option, because from past experience, we get a poor response even if we send pre-stamped and self-addressed envelopes. The face-to-face interviews may be an option.
Face-to-face interviews. Doctor, remember, people came from all over the island to attend this fete. Face-to-face interviews would mean a lot of traveling. And most likely these people are working people, so the interviewers may be on the road at night.
No, we wouldn't want interviewers knocking at people's doors at night. What do you think about email?
Many people don't have email at home, and those who do, how likely is it that they would check daily during this carnival season?
That's why I think the phone interviews would be our best option. I think that's the way to go.
What about people who use their answering machines to screen calls, and those who are not at home to answer their phones?
That's true. Now, no method is perfect, but I think that in this instance, the phone interviews would give us the greatest response. The questionnaire we have is short, and people would be able to quickly answer it over their phone. Now, I think we should organize to call between 5 and 9 p.m. so that we can catch people after work and before they leave to go to fete.
Exactly how many people are to be interviewed?
I'd need to call statistics on that. Hello, statistics. I'd like to speak to Mr. Andrews, the statistician. Andrews, Rogers here. The investigation we were talking about, we're talking sample size now. The fete was big. There were between 2,500 and 3,000 people at the fete. Yes, and the list of cases from the hospital, 21 cases. I need help with analyzing the data if you are around. Okay, thank you. Say hello to the family. Okay. The statistician is saying that we need to aim for 75 cases and 125 controls. That's 200 reports. A manageable sample in terms of time, money, and logistics. So we need to organize to get between 4 and 5 persons to make the calls from at home in the evening, and we will make arrangements to pay for the calls. Now, could you arrange to have a meeting between yourself, myself, and 3 other surveillance nurses who could assist us in the project?
Okay, doctor, I'll get on that.
So, how do we determine what the correct sample is? Well, there is no one correct answer. In an ideal world, an investigator would have a statistician calculate the sample size based on the highest possible power for the study. However, in the real world, we're usually constrained by factors such as the number of available participants, the rate of disease in the population, logistic problems, and limitations with respect to budget and time. Also, we don't always have a statistician available to us. So, while we would all like to have the highest power for all our studies, we have to consider all the constraining factors and decide what is the highest power that we can actually afford.
Okay, good afternoon. Now, we've made some amendments to the standard CAREC surveillance forms, and we're going to be using these in the investigations. I'd like each of you to look at a copy, and I want you to remember that we need to get this information as quickly as possible while it's still fresh in the minds of the patrons who attended the fete, because we don't want so much time to elapse that they forget all the critical data that we need to collect from them. Now, if we look at the forms, we see that we've left out certain things that would be standard on the forms.
Hello, this is Nurse Charles. I'm calling on behalf of the Ministry of Health. Yes, this is in connection with the outbreak following the Caribbean Fun Fete. From the hospital report, I realized that you were one of the people who fell ill. We are doing an investigation to prevent something like this from happening again. Would you help us by giving us a few minutes of your time and some information? Yes, thank you very much. Can I have your full name, please? Okay, your age. Right, your address.
The outbreak investigation steps covered in this video were: relate the cases in terms of person, place, and time. This would include doing a line listing and drawing an epicurve. Formulate a hypothesis, and we discussed what a hypothesis is and how it is constructed. Plan and conduct a detailed epidemiological investigation, which could be of 2 types, a case control or cohort study. The sample size for your study is related to its power and is limited by several constraining factors. The remaining 4 steps to complete this investigation will be covered in video 3 of this series. Hello, this is the 3rd video in a 3-part series on the steps involved in conducting and managing an outbreak investigation. In the first video, the medical staff at the Kariba General Hospital suspected that there was an outbreak of diarrheal illness following the Kariba Fun Fete. The medical officer of health was contacted, and he and his team were able to confirm that this was indeed an outbreak. They also verified the diagnosis, made a quick assessment of the patients, and formulated a case definition to be used in the outbreak investigation. In the second video, the medical officer of health and his team related the cases in terms of person, place, and time. formulated the hypothesis that a food served at the Kariba Funfet, probably the potato salad, was contaminated with salmonella, which made people ill. Then they planned and conducted a detailed epidemiological investigation. So the first 6 steps of the outbreak investigation have been completed. After viewing this video, you and your team should be able to conduct data analyses, formulate a conclusion, put control measures in place, and write a report on the investigation.
I see you've completed the interview forms.
Yes.
How was the experience?
Very interesting. I didn't realize how persistent you had to be. Some people we had to keep calling over and over before we got through. Some of them were very short. Others we had to beg to come off the phone. Then there were some who wanted to know why now, since they were already recovered. I had to explain to them that we are doing this to ensure that it doesn't happen again. But in total, we have 49 cases and 100 controls. So it's 149. What do you think? Do you think we should call back to ensure that we contact the people we have not?
No. We got 149 reports. That's what, 75% of what we were aiming for. I will call the statistician to double check, but I think we're okay.
Okay, so what do we do now?
Now that the data has come in, analysis needs to be done to get useful information and ascertain which food caused the illness. The first thing to do would be to create a full line listing.
We need these forms typed up into a line listing. Is there anyone in the office who can do this?
Yes, Mrs. Yearwood. She has done this thing before, and I will indicate to her what headings to include.
Okay, I need her to complete it by tomorrow.
Yes, I believe she can. She's a very fast typist, and I will pull her off her regular duties to do this.
Okay. Hello? Oh, nurse. Oh, the line listings are ready? Oh, hold on. No, I'm not going to be able to attend to that. An emergency has come up and I'm going to be called away. The statistician is going to be unavailable as well. I have taken the liberty to call Dr. Wills, the district medical officer for the Northern Regional Health Authority. Now, she's going to be coming and she has an MPH. She's also worked with a statistician before, so she's going to be able to continue the investigation. Okay. What I want you to do now is to give her a call. She's expecting to hear from you. All right.
The district medical officer and the surveillance nurse now need to use the data in the line listing to calculate attack rates, odds ratios, and significance tests. An attack rate is defined as the number of new cases of disease during a specified time period divided by the total population at risk during the same time period. This is usually multiplied by a factor of 10 to make it a whole number. The term attack rate used in outbreaks is actually an incidence rate. That is the rate of occurrence of new cases.
We will use the attack rate form from the manual and write in the food. We'll both do the calculations and validate each other. I've made copies of the blank form. We'll use this to tally it out. And this is how we'll do the calculations. We'll use fried rice, for example. We'll consider all those persons who ate fried rice and then add up the number of those who got ill and the number of those who did not. Work out a total. Then we'll calculate the attack rate for those who ate fried rice by dividing the number of those who got ill by the total and multiply by 100. Then we'll do the same for those who did not eat fried rice.
Okay, let me see if I have this right. If I were calculating the attack rate of those who did not eat fried rice, I would add the number of people who did not eat fried rice and got ill. Those people who did not eat fried rice and did not get ill, I would add the two numbers together to get a total. Then I would divide the number of people who did not eat fried rice and got ill by the total and multiply by 100.
That is correct.
Okay.
I got 35% for the fried rice.
Those who ate the fried rice?
Yes, those who ate
I got
it.
that.
Okay, and 29